I'm going to tell you a little bit about the community nursing transformation, the journey that we've been on more than the actual product that we've come up with. So if I take you back to 2014, we had a lot of frustrated, concerned, demotivated, concerned staff who were telling us we can't deliver the best patient care possible because there are so many barriers and challenges in our way. There's so much inefficiency, it just makes things really difficult and we're running around trying to do the best we can and we're exhausted. So we said, right, we need to do something about this. So we set up an event. We got a nice room at the Kettering Park Hotel. We put on a nice lunch because people will come if you throw in a lunch, and we ring-fenced staff time. So we said we will make a way so that we can have representatives from every grade, phlebotomists through to ANPs, specialist nursing, district nursing, ICT or admin staff. We invited colleagues from learning and development, project management, children's services because they'd been looking at something similar, our lay governors, our staff side representatives, and we said to them, right, just sock it to us, tell us everything that's not working for you. And we came out with reams and reams and reams of paper, and it was incredible. We had major inconsistencies in how things happened, even within services, even within teams in the same location within services. So we said, we got to do something about this. Who's coming on a journey to help us? And 90 staff put their hand up and said, we want to be part of this. 90 staff who worked across 4 separate work streams, and this is just one of them, to come up with the solutions to the problems we were facing. Our showcase today has been around the single point of access and the journey that we went on to get to where we are now, which is a semi-functioning full county single point of access. The sort of things that they told us were going really wrong for them were, one road, 4 insulin patients registered at 3 different GP practices in 2 separate localities. That's 3 different staff members going out to within 50 yards of each other twice a day. Not a good use of NHS resources. Sign on the front door of a housebound patient. Dear nurse, I've gone to the hairdressers, could you pop back after 4 p.m? Wasted visit. I went in to do Bert's legs, and when I got to the home, there was another trust nurse leaving. Why couldn't they have done the visit? The one that really concerned me immediately was when staff were standing in front of me and they were saying, I have no time for lunch. I don't even have time to go for a wee. Now that's about staff well-being, and that's really worrying. If we don't look after our staff, we can't deliver really good patient care. So our staff designed a brand new way of managing the multiplicity of referrals. They came up with referral management goals. So they said to us, this is what good will look like. This is what you need to have in place to be able to do this. It wasn't us telling them, they told us this is what you need to sort out. So they designed this system, we just helped it along the way. And we already had some wins that we've got from this project. We have reduced the need for field-based nurses to ring round for info. They've got everything they need now when they go in to see the patient. We've released clinical time in teams, which we've used for either more clinical visits or to do other improvement projects. This is the biggie, integrated working across ICT and district nursing. That's major cultural change. We've still got a really long way to go with that, but we've busted some of the myths, and we have people working side by side in the SPOA, and it's a long way from where we were 2 years ago. We use ICT, don't do this. District nursing, never do that. Actually, let's put them together and let's work it out. Robust clinical decision processes that are led, designed, driven, validated by our clinicians. That's their baby. They know what they are doing. E-referrals for GPs and the 111 service, and we're hopefully going to be going live with the acutes in the very near future. Reduction in unnecessary trips to collect things, 1 single point of referral. So, okay, a big workshop event is great, but you can't always get everybody there and the service still has to run. So what else did we do? Video clips. Yeah, I'm not good with that, but I did it. Team talks. Survey monkey. Staff became very, very used to getting a survey monkey. We had a dedicated email address for the project, so people could email in and say, look, I know you're looking at this, but I'm really concerned because in our area this is what happens, and actually I don't think you've thought about this. That was really useful. What if we, so people would say, well, what if we did this? So we'd say, okay, and we'd send it out to staff, and they'd say, well, if you do that, then this is going to happen in our area, or if you do that, have you thought about this? Union representation on our steering committee. This is key, because by doing this, we haven't had to go to staff consultation, because our staff have owned and led this. Our staff side reps have been involved from day one. Newsletter updates. Any way that we could get the message out there about what we were doing, get people's views. I think the main innovation has been the engagement with the staff. We've had multiple events, multiple channels for getting the message out there, getting people involved, and we've had some really good learning. We learned that if you're going to do a project of this nature, do a plan, do, study, act cycle, but make it led by your stakeholders. That way, when things do go wrong, the quality of solutions that you get are much better, much broader, and pick up all those little variances that are in the health economy. The other one, clinically led leadership, really is important. If it's a clinical service, the change has got to be led by clinicians. The product that we have, whilst it's operational in the south of the county and at the weekends, we still need to move it into the north of the county, and that's a work in progress. But from the point of view of what we've already seen in terms of benefits, staff are reporting that it's released clinical time. We've been able to make sure that we're delivering the right care to the right patient by the right staff member with the correct skill set. And this is really important in a climate where the demands upon the service are ever increasing, and we need to be flexible to meet the changing needs in the healthcare environment. Thank you.